Hello, and thanks for watching this online presentation of our study into sensitisation to cross-reactive carbohydrate determinants in Britain's bakers. This research was undertaken by the Department of Occupational Medicine at Imperial College and the Royal Brompton and Harefield NHS Trust. Today we'll be looking at a bit of background information on cross-reactive carbohydrates, the conceptual basis for the study. We'll highlight the study aims, methods and results, and finally move on to discuss the conclusions and any future direction this study may take. So first, for a little bit of background. Many allergens that appear throughout the plant and animal kingdom have complex carbohydrate chains bound to their peptide backbones. These allergens include pollens, insect venoms, and most importantly in bakers, plant-derived foods such as flour. The carbohydrate chains are known as cross-reactive carbohydrate determinants, or CCDs. And these side chains have a much greater degree of structural homology between them than the proteins to which they are bound. Now, current evidence in the literature suggests that the specific IgE to CCDs does not cause clinical symptoms of allergy. So what's the conceptual basis of our research? Well, occupational asthma is the commonest form of work-based lung disease in the developed world, and almost all cases of occupational asthma due to high molecular weight allergens are caused by a Th2 cell IgE-mediated hypersensitivity response, the mechanism of which is illustrated on the right-hand side of the screen now. The baking industry is associated with a high incidence of occupational asthma, and recent data suggests that the presence of IgE, or antibodies, to CCDs may interfere with serum IgE analysis used to diagnose occupational asthma at centres like ours at the Royal Brompton. In fact, health surveillance schemes rely heavily on serum IgE to allergens in the diagnosis of baker's asthma, and a diagnosis can have huge implications on the baker, including job loss. It's therefore extremely important that our diagnostic test is reliable, and since CCDs have been identified as possible sources of interference with this test, it's important to investigate this further. This study essentially represents a pilot study, investigating the likelihood of CCDs causing significant interference into serum IgE analysis of baker's asthma. So on to our aims. We set out to determine the prevalence of CCD sensitisation in UK bakers, to identify whether CCD sensitisation is more prevalent in bakers sensitised to flour, grass pollen and alpha amylase, to determine whether co-sensitisation to flour and grass is likely to be due to cross-reactivity caused by CCDs, and finally, to assess what level of interference, if any, specific IgE to CCDs causes in the detection of specific IgE to flour. So on to the methods. We took 209 UK bakers attending our occupational asthma clinic and performed skin prick testing for sensitisation to grass pollen, house dust mite, cat hair and flour. We further obtained serum samples from those bakers and using immunocap technology determined those with specific IgE to a common CCD, MUXF3. In the 14 bakers with specific IgE to MUXF3, the CCD, we further tested for specific IgE to grass pollen. We then performed competitive inhibition assays to detect cross-reactivity between MUXF3, flour and grass. Competitive inhibition assays essentially work like this. The patient's serum sample, containing their IgE antibodies, are mixed with an allergen, in this case flour, and any IgE specific for flour binds. The serum-flour mixture is then introduced into a well, which has a solid phase at the bottom. This solid phase is kind of like a sponge, and this sponge already has the CCD MUXF3 bound to it. Now, the IgE that hasn't already bound to the flour can bind to the MUXF3, and we can detect the amount of IgE binding to MUXF3 by further introducing a fluorescently labelled anti-IgE into the mixture. So now on to what we found. Of our cohort of bakers, 60% were sensitised to flour and 48% were sensitised to grass pollen, but only 7% were sensitised to the MUXF3. So we moved on and looked at the relationship between MUXF3 and flour-specific IgE, and we found that of the bakers sensitised to MUXF3, all were co-sensitised to flour. We then looked at the relationship between MUXF3 and grass sensitisation, and we found that CCD sensitisation was more prevalent in bakers sensitised to grass pollen than those not sensitised to grass pollen. Looking at the relationship between flower and grass sensitization, we further found that flower sensitization was more common in those bakers sensitized to grass pollen than in those unsensitized. So we're starting to build a picture suggesting a degree of cross-reactivity between flower and grass, and some further evidence that CCDs may be the root cause of this cross-reactivity. Next, we examine the cross-reactivity between MUXF3 and either flower or grass using the competitive inhibition assays described earlier. We found that inhibition of IgE binding to MUXF3 by flower and by grass was substantial, though very variable from patient to patient. This essentially suggested that MUXF3 does play a role in the cross-reactivity between flower and grass, at least in some patients. So what can we conclude from all this? Well, we can say that in reality, few bakers in the UK are actually sensitised to CCDs, only around 7%, and thus the impact on serum IgE analysis in the diagnosis of baker's asthma is likely to be relatively small. However, those that are sensitised to CCD are also co-sensitised to flower and grass pollen, and in these bakers, sensitisation to grass and flower could be due to CCDs. Our inhibition assays further suggested that in some bakers, CCD-specific IgE could cause false positive results. We can use the results of this study to improve our programme in terms of making diagnosis of baker's asthma. New semi-synthetic CCD blockers can eliminate the effects of CCDs in a patient's serum, and should be at least considered when bakers have specific IgE to flower, grass, and CCDs, but have an unconvincing clinical history of allergic symptoms. Thank you very much for listening.